Hello, I'm Dennis Pullin. One of my favorite parts about being president and CEO of Virtua Health is getting to know our colleagues and the many ways they are here for good. Each person contributes to healthy communities, and each person has a story to tell. Let's meet one. Jamaar, welcome to Here for Good.
Oh, thanks for having me.
So listen, I know you've been around Virtua for a long time.
Absolutely.
Tell me a little bit about your journey.
So I actually started in Virtua in security. Again, being in security at our Marlton campus, that was kind of the only campus I kind of worked at. And then in 2021, I actually got a position as the Observer Program Manager to kind of oversee our Observer Program for all 5 acute care facilities in both satellite emergency departments.
So describe for me what the Observer Program is. Somebody that doesn't know what an observer is.
We actually create and foster a safe environment for some of our challenging patients. A patient that could be a fall risk, patient that could be a safety observation, or it could be a psychiatric patient. Observers come in and make sure that while they're here in our hospitals that they're safe.
A much needed service, obviously. But what makes a good observer? What do you look for when you're hiring someone to fill that role?
You literally have to have a conversation with them.
Mm-hmm.
You have to see if they have the customer service, if they have the compassion, they have that ability to make sure that somebody is safe. Because again, it's something that you just can't just teach somebody. That is probably the hardest part. So my interview process is a very long, intense interview process because again, I want to just not ask those basic interview questions. I want to see how the person is for themselves.
What do you think some of the misconceptions are around the expertise that's needed to do this particular type of work? You know, not everybody can manage people that are needing behavioral health services. So tell me a little bit about the misconceptions you think people have about your area of expertise.
I would say it's probably more focused on knowing yourself and not letting your emotions take over. I think that's probably the most expertise things I can probably say. Because again, when we're dealing with challenging patients, we might have patients who are a little bit more aggressive, a little bit more violent at times. Again, so we have to control our emotions the way where we can kind of say, you know what, I see that this person is escalating. I see that this person might have a crisis moment. I can't let these words or let their actions kind of say, I'm not going to be able to kind of service you. I'm not going to be able to take care of you.
So you play a large part sometimes in helping to de-escalate the
Absolutely,
situation.
yes. We want to most definitely de-escalate the situation as much as possible. Verbal de-escalation is probably the most important. Just getting to know your patient.
You say verbal de-escalation?
Yes, verbal de-escalation.
Maybe describe that a little more fuller for me.
So verbal de-escalation is actually talking to the person if they're starting to escalate or whatever, kind of be as understanding, be as compassionate. And that's probably the most important thing is being compassionate, letting them understand that, hey, I understand what you're kind of going through or whatever. I know this is a very challenging time. I understand that you're here at the hospital. I understand that you don't want to be here at the hospital or whatever, because that's where basically when people come in. But we're here to make sure that you're safe. We want to make sure that you get to your next level. We want you to be the best version of you. So that's what we want to kind of make sure that we're talking to our patients and kind of foster that environment for them so they can kind of say like, you know what, I am at this crisis moment or whatever. Virtua is here for me. You are here for me. You're going to make me the best version of me. And that's how we want to make sure that when we send you off and get you discharged, that you are going to be able to survive outside of Virtua.
Has practicing excellence help you and your team in terms of creating different patient scenarios?
Virtua has gave us these tools to kind of really put what we already been doing kind of into a place. Practice of excellence has a lot of tools and opportunities for us to understand that we can't focus on just our colleagues and focus on ourselves. We have to focus on understanding that our patients have precipitating factors, and then that making sure that they understand that we're here, again, here for good.
So you have a reputation of being someone who is always upbeat, cheery, compassionate, but yet you see people that are oftentimes at their worst.
Absolutely.
You know, what enables you to keep such a healthy outlook?
We have to really love life. When you love life and when you wake up every single day or whatever, yes, opportunity to have impact on somebody's life. Don't look at it as being a selfish. I don't believe in bad days. I believe in bad moments. So again, looking at impact as, hey, I want to have a positive impact in your life. I want to come in and smile. Hey, Dennis, how you doing or whatever? Because that's going to make you smile. It's going to make you happy.
Because I need it. Trust me. I do, because you deal with people that are going through some very difficult times. And sometimes they can't see a way because they're thinking there's no way. And yet you and your team have to play a vital part in helping many of our patients, family members, and even sometimes colleagues work through some very difficult situations. But that has to take its toll on you and your team. Can you talk about maybe some of the things you do for your team to help keep them with the same positive outlook that you have?
Since the pandemic, Virtua has included Microsoft Teams. So Microsoft Teams, it's one of the things that's challenging for me in my role is that I don't see my team every single day. On Microsoft Teams, I actually utilize some of the tools that Virtua allows us to have. I'm showing them, hey, I understand that you're dealing with this challenging patient. I'm available. I will come. If you need to take a break, you can go ahead and take a break. My team just wants to be supported. And that's probably the most important thing. And that's one of the things that I pride myself is that my team is supported. I'm here for them. I'm here for their mental health. I'm here to make sure that they are the best versions of them the same way we do for our patients.
So I'm going to switch gears on you a little bit. We talked a lot about your team. Let's talk a little bit about you. I hear you recently spent some time in my hometown of Houston, Texas. What the heck took you to Houston?
So I actually finished in my master's degree in mental health counseling. And I had to do my clinicals at the Houston Medical Center. So I had to spend some time there. I had some time to play at the same time.
So was it a good experience?
Oh, it was a great experience.
Did you come back a Dallas Cowboy fan? Never mind. I do know that in your off time, you love the game of tennis.
Yes.
You know, how did that come about? What attracted you to tennis?
It was something that my mom came up when we were a little younger, where me and my dad, mom, and cousins, we can kind of play tennis. But I actually involved myself into watching tennis, learning the game, seeing Serena and Venus. So I've been playing for over 20 years.
So I'm a little older than you, but one of my dear lifelong friends is a retired tennis pro by the name of Zena Garrison.
Okay.
And when Zena was playing, she got to be number 4 in the world. And she has many times invited me to play tennis with her. And my ego won't allow that to happen because I refuse to have her just cream me all over the court. Is there anybody that you would like to play with?
I will always say Serena Williams. Serena Williams is probably like...
Oh, you just want to go for the
Absolutely. That is a person I will always want to play. I will probably be terrible that day because that's just one of the people that I feel like she's probably my favorite player of all times. But again, I could do Rafael Nadal.
You have your sights set pretty high.
Absolutely.
But you know, you talk about big. I will tell you that, Jamaar, I think the work that you and your team does for our patients, for Virtua, for this community is big. And so thank you for everything that you do. Thank you for, being such a compassionate person and caring about how we impact the lives that come to us for care. So thanks for joining us on Here for Good, the Inside Edition.
I appreciate that.
Again, we've had an opportunity to speak with one of our most talented colleagues, someone that is truly making a difference here at Virtua. Tune in next time for our next edition of Here for Good, the Inside Edition.